COVID-19 pandemic in Mexico. The tragedy scope. From the beginning, the response of the Mexican government towards the COVID-19 pandemic was to diminish its importance. As a consequence, neither the Mexican health system nor the population were prepared to deal with the upcoming situation. The governmental narrative has featured contradictory messages between the President of the Republic and the Secretariat of Health Authorities. Sanitary personnel have been one of the biggest victims. By June 16th, the Secretariat of Health reported that 21% of contagions were health and sanitary personnel. As a matter of fact, 2.6% of the total fatalities in Mexico are doctors and sanitary personnel. Our doctors and nurses have not been protected. The official figures presenting fatalities and contagion have been contested, and the forecasts underestimated and recurrently wrong. Many of the sanitary measures were improvised and poorly designed. The government embraced a false dichotomy between health and the economy. Social distancing measures were not applied on time nor strictly, and contagion wasn't deterred so as to permit economic activity. The government refused to grant income to people so they could stay at home. Without that sustenance, millions of people couldn't allow social distancing. We fell into the trap of saving the economy at the cost of our lives, a false dilemma. The number of fatalities is also underregistered. Mexico City is an excellent example. The reported casualties from January to May 2020 exceed by almost 15,000 the average number registered in the same time frame from 2016 to 2019. Of those, only 3,625 are reported as COVID-19 fatalities. Mexico is now the fifth country with more casualties. We have surpassed Spain, Italy, and France. How many deaths could have been avoided? The most optimistic forecasts estimate more than 50,000 deaths by the end of August. Even so, authorities lifted social distancing. The pandemic is out of control. Socially and economically speaking, the landscape is just as desolate. It has been foretold that the gross domestic product will fall by 8% in 2020, and the recovery will be very slow. The government plan to palliate the labor and economic crises was timid, late, and ultimately not enough, with grants of less than 1% of the GDP, while other governments granted 5, 10, 15, even 30% of the GDP. Activity and labor have collapsed, mostly in informal and low-income labor. In May, 12 million people lost their income. 12.2 million members of the middle class will fall into poverty. By the end of 2020, there will be nearly 95 million people in poverty and more food scarcity. Women and children will carry the biggest burden of the crisis. Family violence has multiplied. The digital schism has been exacerbated, and the pandemic is wreaking havoc on the long-distance learning of 80% of adolescents and children. Poverty and inequality in Mexico have gotten even worse since April, and they will continue through the following months and years. We are in the wake of a lost decade. This is the scope of the tragedy.